Hi, my name is Alexis, and I'm going to be your occupational therapy student today. What's your name?
My name's Ethan.
Nice to meet you, Ethan. And how are you?
I'm good. How are you?
I'm good. Thank you for asking. So, what brought you in here today?
Having difficulty with mobility in my left shoulder.
Okay. And are you experiencing any pain?
Yep, pain when I try to move it.
Okay. Is the pain dull or sharp?
It's pretty sharp.
Sharp. Okay. So let me know if you run into any of that pain today, and then we'll stop what we're doing. Okay.
Okay.
Okay. So first, I'm going to have you repeat after me with some movements, and then so I can see how your arms are functioning and moving around. And then after, I'm just going to do a couple of extra measurements using these tools, which are called goniometers.
Okay.
Okay. Any questions before we start?
Nope.
Okay. So have you stand up, and I'll have you stand over here. All right, so first I'm gonna have you raise your arms all the way up above your head as far as you can. Good, back down. Behind you. Okay. We're doing a jumping jack. Like we're touching and washing the back of our head. All right, like we're tucking our shirt in the back. Okay, all right. Feeling okay still?
Yep.
Okay. Bring them up to your shoulder, back down. Keep your palms up, down. Good. Oh, actually, yeah, go here, windshield wipers. Good. All right, how did that feel?
That was fine.
Okay. All right, so you can go ahead and have a seat. I did see that you had a little discomfort when you were doing your
Yep, raising my arms.
yeah, for your left shoulder. How long have you been experiencing that?
A week or so.
A week or so? Okay. And did you experience any pain when we were doing those motions?
Just some discomfort. As soon as it started to hurt, I just stopped moving.
Okay. All right. Well, let me know if that happens for this next step. But now that I see how your arm is moving, I'm going to go ahead and do a couple measurements, okay? All right, so I'll have you stand back up and face that way. I'll have you step back just a couple steps because there's a light right there.
Mm-hmm.
All right, so I'm gonna have you keep your arm close to you as far as you can. All right, so he's 1 to 2 degrees for extension, so we can run that to 0. All right, so I'm gonna have you raise your arm straight above your head as far as you can. All right, is that as far as you can?
Mm-hmm.
All right, we're at 55 degrees for shoulder flexion. Okay, I'm gonna go ahead and stand behind you. Can you keep your arm next to you? Good, so we have 0 degrees for adduction. All right, I'm gonna have you bring your arm out like you're doing a jumping jack as far as you can. All right, so we have about 60 degrees for abduction. Okay, so I'm gonna have you go ahead and keep your arm bent next to you. All right, and so I'm gonna have you go ahead and bring your hand to your belly as far as you can. All right. So we're at 20 degrees for internal. All right, just 1 second. All right, and then you can go ahead and bring your hand out as far as you can. Do it a little further. Good. Okay. So we're at 10 degrees for external. Okay. Can you keep your arms straight as far as you can?
Mm-hmm.
All right, so the elbow flexion is 0, extension, elbow extension is 0. Okay, I'm gonna have you bring your arm and touch your shoulder as far as you can. Okay, so right there. We have 125 degrees for elbow flexion. All right, so I'm actually going to go ahead and grab this little one here. Go ahead and keep your arm, yep. So I'm going to have you flip your palm down to the ground. Okay. So we're at about 80 degrees for pronation. All right. So have you flip your hand up as high as you can. We're at 75 for supination. All right, so I'm gonna have you go ahead and take a seat.
Mm-hmm.
You can angle your body just that way a little bit so the camera
Sure.
can see. Thank you. Go ahead and get your arm. Can you keep this elbow back just a little bit? There you go. All right, so I'm gonna have you bring your hand, your wrist up, your fingers to the sky as far as you can. All right, so we have 45 degrees for wrist extension. All right, and then I'm gonna have you bring your wrist back down. Bring your elbow out a little bit. Okay, so as far as you can go?
Yeah.
All right. So we have 75 degrees for wrist flexion. All right, and then 2 more. I'm gonna have you bring this elbow back on your leg. Good, and keep your hand flat. All right, so I'm going to have you bend towards your thumb side as far as you can. Okay. So we have 15 degrees for radial. All right, and then go out towards your pinky. All right, and then we have 30 degrees for ulnar deviation. How you feeling?
Just fine. That was good.
Good. Any questions?
Nope.
Oh, all right. Thank you.
Thanks.